The placenta is fully formed by, the correct answer is option B, at 12 weeks. By the end of the first trimester, placenta development is completed and begins functioning fully for nutrient and oxygen exchange. A reactive NST includes, the correct answer is option C, good bit to bit variability with accelerations. A reactive NST means equal or more than 2 accelerations in 20 minutes with normal variability. That indicates good oxygenation. Severe preeclampsia is diagnosed when BP is, the correct answer is option D, 160 by 110. Blood pressure above 160 systolic or above 110 diastolic indicates severe preeclampsia requiring urgent management. Eclampsia is defined as, the correct answer is option C, convulsions with preeclampsia. Seizures occurring in a woman with preeclampsia is called eclampsia. It is a life-threatening obstetric emergency. Drug of choice for eclampsia. The correct answer is option B, magnesium sulfate. Magnesium sulfate prevent and control seizures and it is a golden standard in eclampsia management. Normal amniotic fluid index is, the correct answer is option B, 5 to 24 centimeter. Amniotic fluid index 5 to 24 centimeters is normal. Less than 5 is oligohydramnios, more than 24 is polyhydramnios. Kick count should be taken. The correct answer is option B, after meals. Fetal activity increases after eating, ideal time for kick count monitoring. Most common cause of bleeding in early pregnancy. The correct answer is option C, attended abortion. Spotting or slight bleeding before 20 weeks is most commonly due to attended abortion. Anemia screening in pregnancy is done. The correct answer is option D, in first and third trimester. HB must be checked early to detect anemia and again later to monitor progression. Fertilization normally occurs in, the correct answer is option B, ampulla of fallopian tube. The ampulla is the widest part of the tube and is the usual site for conception. Alpha fetoprotein decreases in, the correct answer is option D, Down syndrome. In trisomy 21, alpha fetoprotein is low because fetal development is slower and AFP release is reduced. AFP increase in, the correct answer is option C, neural tube defects. Open defects like spina bifida leak AFP into amniotic fluid, raising levels. Most common cause of recurrent miscarriage. The correct answer is option B, genetic abnormalities. Chromosomal issues account for 70% of recurrent early pregnancy losses. Best test for fetal well-being in high-risk pregnancy. The correct answer is option B, biophysical profile. Biophysical profile assess movements, breathing, tone, amniotic fluid, and NST. So it is a most comprehensive test. Components of BPP include all except, the correct answer is option D, placenta weight. Placenta weight is not a part of BPP, that is biophysical profile. Biophysical profile consists of 5 ultrasound and NST parameters. Fetal cardiac activity is first seen by ultrasound at, the correct answer is option B, 6 weeks. A flicker of the fetal heartbeat is visible by 5.5 to 6 weeks via transvaginal USC. Vaccine and contraindicated in pregnancy. The correct answer is option C, MMR. MMR is a live vaccine and can harm the fetus, avoided in pregnancy. Most common symptom of urinary infection in pregnancy. The correct answer is option B, burning urination. Dysuria, burning is a classic symptom of UTI in pregnancy. Twin pregnancy typically leads to, the correct answer is option D, all of the above. Twin gestation leads to higher hormones and faster uterine enlargement. Leopold's maneuver help identify, the correct answer is option B, fetal lion presentation. There are 4 clinical palpation steps used to determine fetal position. Earliest ultrasound sign of pregnancy. The correct answer is option C, gestational sac. Seen as early as 4.5 to 5 weeks, the first visible sign. Best investigation to confirm ectopic pregnancy. The correct answer is option B, transvaginal ultrasonography plus serum beta human chorionic gonadotrophin. Combination confirms ectopic early and accurately. Most common cause of polyhydramnios. The correct answer is option A, diabetes. Maternal diabetes is fetal hyperglycemia, causes polyuria and it increases amniotic fluid. Paternal diabetes causes fetal hyperglycemia and it causes polyuria, and last it increases amniotic fluid. Engagement of fetal head occurs when station is, the correct answer is option C, 0. 0 means the widest part of the fetal head has reached scale points equal to engagement. Normal weight of the placenta at term. The correct answer is option C, 50 grams. The placenta typically weighs around 450 to 500 grams at full term. Placenta previa typically present with, the correct answer is option B, painless vaginal bleeding. Placenta previa, placenta covers cervical opening, causes sudden bright red painless bleeding in the third trimester. Earliest time of pregnancy on ultrasound is, the correct answer is option B, gestational sac. Gestational sac is visible at 4.5 to 5 weeks even before the yolk sac or cardiac activity. Normal cervical length in pregnancy is the correct answer is option B, more than 3 cm. Cervical length less than 2.5 cm is associated with preterm labor risk. Major source of amniotic fluid in later pregnancy. The correct answer is option C, fetal kidneys urine. After 20 weeks, fetal urine account for the majority of amniotic fluid. Quickening is filtered. The correct answer is option C, 16 to 20 weeks. Mother perceives fetal movements around at 16 to 20 weeks earlier in multiparous. True labor pain is the correct answer is option D, regular and progressive stronger. True labor contractions increase in intensity, frequency, and duration. A non-reactive, non-stress test suggests the correct answer is option D, both B and C. Fetal sleep cycle, possible fetal hypoxia. Non-reactive NST can be due to fetal sleep or oxygen deprivation requires further testing. Fetal movements decrease in. The correct answer is option D, all of the above. Reduced activity is often the earliest sign of fetal compromise. Iron absorption improves with. The correct answer is option D, vitamin C rich foods. Vitamin C enhances absorption of non-heme iron. Tea or coffee inhibit absorption. Most common cardiac disease in pregnancy. The correct answer is option B, mitral stenosis. Rheumatic heart diseases most common cause in developing countries. Antenatal visit schedule for normal pregnancy. The correct answer is option D, all of the above. This is the standard WHO antenatal visit schedule. Monthly till 28 weeks, every 2 weeks till 36 weeks, weekly till delivery. Height of uterus at 12 weeks. The correct answer is at symphysis pubis. At 12 weeks, the uterus becomes palpable above the pelvic bone. Umbilical cord normally contains. The correct answer is option A, 2 arteries and 1 vein. The arteries carry deoxygenated blood to placenta and single vein carries oxygenated blood to fetus. Teen pregnancy is associated with. The correct answer is anemia, low birth weight, preeclampsia. The correct answer all of the above. Teenagers have high risk pregnancies due to nutritional deficiencies and immature physiology. First clinical sign of preeclampsia. The correct answer is option D, hypertension. Blood pressure rise in the earliest detectable feature of preeclampsia. Best indicator of fetal hypoxia. The correct answer is option B, late deceleration. Late decelerations indicate uteroplacental insufficiency and fetal hypoxia. Earliest sign in breast during pregnancy. The correct answer is option C, breast tenderness caused by rising estrogen and progesterone levels after conception. A pregnant woman should strictly avoid. The correct answer is option D, all of the above. All can cause congenital anomalies, growth restriction, or miscarriage. Most common type of anemia in pregnancy. The correct answer is option B, iron deficiency anemia due to increased demand, low intake, and increased blood value. A first trimester danger sign is. The correct answer is option D, heavy vaginal bleeding indicates possible miscarriage or ectopic pregnancy. Abruption placenta classically shows. The correct answer is option B, painful bleeding plus abdominal rigidity caused by premature detachment of placenta resulting severe pain. Breech presentation is common at. The correct answer is at 28 to 32 weeks. Before 32 weeks, many babies are breech and later turn to cephalic presentation. Maternal blood volume increases where. The correct answer is 40 to 50%. This support fetal growth, uterine blood flow, and prepare for blood loss during delivery. Most common cause of postpartum hemorrhage. The correct answer is option A, uterine atonement. Failure of uterus to contract causes massive bleeding, leads to cause of postpartum hemorrhage. Most reliable sign of pregnancy. The correct answer is option D, positive ultrasound. USC confirmation is gestational sac, fetal pole, cardiac activity is definitive evidence of pregnancy. Thank you all.